liposuction, there's a number of options. There's three basic types of liposuction. The traditional liposuction, which is also called tumescent liposuction, laser liposuction introduced by Smart Lipo or Cynosure company, and then ultrasonic liposuction. All three types of procedures are going to do the same thing, and basically what they're doing is destroying fat cells and then sucking them out. So as an adult, when you gain weight, your existing fat cells just get bigger, and when you lose weight, they shrink. So you don't make new fat cells as you gain weight. So what liposuction does is it's a permanent way of contouring the body. You'll never gain weight the exact same way in those places again. Now, what is the best type of liposuction? I believe that all three work very equally. There is no big advantage of one over the other. In fact, I think traditional liposuction is the safest way to perform liposuction. With the other types of liposuction, you're using energy, and energy can cause burns. The advantage that the manufacturers like to tout is that the energy can cause shrinkage of the tissues. Well, you can see the same type of shrinkage with liposuction performed with a basket cannula. It also creates that same type of shrinkage. We have all three types of liposuction in our office. All three are available. But again, my preference is to just use traditional liposuction. We will use the others in difficult situations where there is a lot of scar tissue. People have had previous liposuction, and it's difficult to get through that scar tissue with a traditional cannula. The procedure is done in our office. It's done under IV sedation. A typical area will take 45 minutes to an hour. The procedure is done through tiny little holes about a quarter of an inch in length. So once they heal, they're virtually impossible to see. Once the person is sedated and they're asleep, we infiltrate the fat with a very dilute local anesthetic that has epinephrine in it. The epinephrine constricts the vessels, so when we perform the liposuction, basically what you're seeing is pure yellow fat come out with very little bleeding. Afterwards, we put you in a compression garment that you wear for 3 weeks. It's not a painful recovery, it's more like a bad bruise. If somebody hugs you, grabs you, it's going to hurt, but if you get in a comfortable position, it's very manageable. We do give you pain medication, but again, most people do not need the pain medication. After surgery, we have a recovery room. You'd recover there for an hour or so. I like to see you back within a week to make sure there's no problems. You'll continue to see improvement in those areas that were liposuction up to 6 months and even a year afterwards, because it takes that long for the body to absorb the fat that's been damaged and hasn't been removed by suction. A very gratifying procedure. It works best in people who are at near their ideal weight. It's not really meant as a weight reduction procedure. We often combine it with other procedures like a facelift, tummy tuck, and arm lifts and thigh lifts.